All right, here we are again. Thank you
Yeah,
for doing this, Amy.
you're welcome.
If people haven't seen the first of these, this is Amy Adams, the one of the voices of WIKY Radio,
Hmm.
a noted radio personality here in the area, and a friend of our practice, and somebody that's had quite an interesting experience. So we've already recorded a video about her our use of the ExoMind with her to uh, tune up her brain, basically.
Yeah,
And over the course of working with Amy, we determined that there were some hormone deficiencies.
yeah,
And she's basically sampling the wares. This is a collaboration between Amy and Wiki
yeah.
WIKY and me, Cady Wellness Institute. And so I asked Amy if she would like to try some pellets, some hormone pellets, put into her backside. And this lovely lady, who's got lots of moxie and courage, said, yes, we could take a picture of her backside as I actually put the pellets in. So
Right.
before we get to getting the pellets in, tell us about your experience with the hormones, what the labs, best you can figure out and recall, what the lab showed and why I suggested the pellets to you, what the procedure was like, and how you've been doing since.
Well, first of all, I think part of the depression that I had could have been hormone related because I
Mm-hmm.
basically, after I had all the labs done,
Mm-hmm.
I basically didn't have the estrogen anymore, the
Oh,
progesterone,
that's called menopause.
menopause. That's what it's called.
Yeah, it is
Yes.
called menopause.
And of course, being 55, I'm postmenopausal. So who knows? It's kind of a scary thing wondering what your body's doing. But after all the lab work, I found out that I pretty much had none of that left.
You're on the DHEA
Uh huh.
and the progesterone, right?
Right. I am now taking 200 milligrams at night, which I sleep like a baby, which I was having sleep issues before all of this. So I thought maybe it was from depression as well. So that's why I decided to go ahead and do with the pellet therapy because to me that was the best option because once they're in, I don't have to worry about it for about 3 months. And then it's been 2 weeks out now and I can already tell a big difference.
Let's go back in. You said something very interesting that I
Hmm.
want to camp out on a little bit and have our viewers take a look at. So you're menopausal
Yes.
and you're on 200 milligrams of progesterone.
Right.
By the way, did you know that progesterone is one of the first hormones to drop in menopause?
I did not.
Here's why. When a woman's ovaries begin retiring, they stop making as much estrogen, progesterone, and testosterone. But the interesting thing is the ovaries are the only place in the human female body that makes progesterone.
Okay.
You can get some of your testosterone and your estrogen downstream from your adrenal glands, but progesterone is the first thing to go. So when a woman goes into her doctor and says, Doc, I'm feeling, at your age, 50-ish, 55,
55.
and says, I'm feeling depressed and I can't sleep,
Hmm.
all too commonly the solution is here's an antidepressant and here's a sleeping pill.
Right.
Not thinking that maybe we should look at the underlying biological reason. So progesterone it's like nature's benzo. It's a feel-good hormone for women, helps them sleep. And as long as your ovaries are alive and kicking and pumping it out, you're good. That's the reason you started sleeping so well with
Yeah.
the progesterone.
And I was on 2 antidepressants, and now I'm down to 1 after Exomine. Just letting you know, throw that in there.
Okay.
But yeah, I take that right before bed, and within 30 minutes, I'm out. And it's a good hard sleep, which is something I've not ever done. But with the pellets, it has been the best thing, and I highly recommend it because for me, it's safe. It's very convenient because if I want to go like out of town, I don't have to worry about, taking the pills with me because they're already inside of me absorbing, and within I guess 2 to 3 months they'll do their job. And
They'll do their job during that length of
yeah.
time, and then you'll need some more.
Yeah, but everything is working fine now. That's all I have to say.
What was the question that you asked me the first time about pellets after you had them in you?
I asked, how fast do those things work?
Why did you do that?
Because I was ready to feel better and ready to have more energy and my libido back and all of that. And trust me, it worked. Within, I'd say, 3 to 4 days, I could tell a big difference. That was just for me. It's different for everybody. So,
okay.
yeah.
Thank you for mentioning libido. That helps with the testosterone. Definitely helps with that.
Yeah.
But estrogen, which we put in, you were talking about your depression in the past might have been hormonally related. But on the other hand, you said you've been depressed quite a lot of your life. So you haven't been menopausal that long.
No.
But now the estrogen helps with mood, and it also helps with mental clarity.
Oh, yeah.
What have you noticed about that since the pellets went in?
Well, being on the radio, it's important that I know what I'm going to say before I say it. And I was having trouble like coming up with the right words. And now everything's just flowing clearly, like from my brain out of my mouth. And that's something I've not had in a long time, since I was younger. So that has helped.
So let's talk about what it was like as I put them into you. What was that like, the procedure itself?
Well, it was painless. I mean, I just felt the numbing agent go in. That didn't hurt. And then when he put the trocar in there, it's about 2 inches long, I'd say, 2 to 3 inches long. And that went all the way into my rear end so he could insert the pellets. I did not even feel that. And I would have, if it wasn't numb, I would have come off the table. So it was an in-office procedure, fast and quick, and no downtime. I was back out the door doing what I normally do. I mean, my rear end hurt a little bit, that's just, maybe for 2 or 3 days. That was it.
Yeah. It's the kind of thing that somebody could actually come in over their lunch hour and have.
Oh, yeah, absolutely. Yeah.
And then go back to work.
Go back to work. It's like just getting a shot in the arm.
Okay. So let's give them a preview of coming attractions. So you're also having some of the BTL aesthetic treatments here too.
Yeah. Right now I'm working on the Neo Sculpt, which melts some of the fat off of my belly, and eventually, I guess, my sides of my legs and the sides of my stomach and my backside as well. And that I'm working on. And I've also worked around with the M-Face and the Exion. The M-Face, I'm trying to rejuvenate and get some of these fine lines off of my face, that along with the Exion, with the micro needling. So I'm having a lot of fun doing that too.
Now, just to assure our viewers that microneedling is not some brutal, torturous type thing, because people hear needling is like, I don't want needles. What is this like for you?
For me, of course, there is a numbing agent you can put on your face. I've tried it with and without, and basically it just kind of feels like some little bee stings, and your face is a little red for about 30 minutes, or at least mine was, and then you're fine the next day. I mean, it's pretty simple. And I've noticed some of the lines are starting to disappear. So
the microneedling involves putting needles that are basically little radio towers, about 30 of them, 0.5 millimeters into the skin, and then a radio frequency waves are shot off the tip of the needle.
Right.
So the needle goes in 0.1 millimeter, the radio frequency shoots ahead about 4 millimeters. So it's like taking a needle and sticking it 4 millimeters down, which would be torture. And the benefit of this is it stimulates the underlying tissue, helps you build collagen and hyaluronic acid. And the whole deal is this concept of functional aesthetics.
Right.
So instead of saying, well, let us put some filler in you, we're just having your body make more of it by itself with this technique.
Then it helps Ozempic face too.
It does. Which you had a little bit.
A little bit.
Yeah.
You told me that the first time we met.
Yep, I did. So anyway, I think that's about it for right now. Anything else you want to say?
I also have on my blog the Exion M-Face. Once again, it's wiky.com. Go to blogs, and it's Catch Up with Amy, and it's all kinds of Dr. Cady stuffs on there.
Thank you so much for being here.
Yeah, you're welcome.
Yeah, thank you. Thanks for watching.